So as a result, the first sterilization law in 1935 and the renewed law in 1950 enacted that a person could be sterilized even against his or her own will, usually her own will, if that person's condition was such that it would either be passed to one's offspring or that it would prevent one from rearing the child properly. What amounts either to a forced or a voluntary sterilization is sometimes a matter of interpretation, but if the person was not informed about the operation and the decision was made by a proxy, like the manager of the institution in question, I think it's quite safe. Or if it was considered that the person was incapable of understanding what the operation was all about, then I think it's safe to classify these as forced sterilizations. I had a look at these. I was supposed to conduct research on the archive material of these decisions, but then I went into philosophy. But there were quite a few cases I remember where women wrote to authorities, like about 5 or 10 years after the sterilization, saying that they didn't know what was happening. And yeah. So abortion became also a eugenic tool in 1950 because quite a few abortion permits were granted for eugenic reasons. And sterilization was a precondition for abortion. So if you wanted to have abortion, you got it if you were sterilized as well. And according to official Finnish statistics, 7,530 sterilizations were performed on eugenic grounds between 1935 and 1970, and only 996 were performed between 1935 and 1950. So the heyday of eugenic sterilization in Finland was the late 1950s and early 1960s, where more than 500 people were sterilized annually on eugenic grounds. And it is hard to tell, and also about, I remember from the archives, there were these forms where people were asking, please sterilize me. But it's kind of hard to tell whether that was actually the case, but formally they were voluntary sterilization. But if you lived in an institution, you had an intellectual disability, and if you were told that it's for your own good, well, I don't know whether that counts for voluntary act. Now, this part of Finnish history is considered as troublesome and embarrassing, and thus it's mostly kept in silence. It was reported largely in the late 90s, so about 10 years ago. And the public reaction was really, the people were surprised. Most people didn't know about it.
1996 to be exact.
Okay, yeah. And then also it was a kind of like all embarrassing things, all emotionally difficult things in Finland, they are kept quiet. So we just don't talk about it, so then the problem doesn't exist. And when eugenics is mentioned, the discussion is immediately directed towards Nazi atrocities, of which we had nothing to do with, supposedly, and how different everything is now. And drawing a parallel between eugenic past and the present medical practices is easily labeled as a logical flaw name playing the Nazi card. And indeed, simplified analogies between past and present should be avoided as nothing else, as unhelpful. And in my view, reminding about the eugenic past is not always a very good way to start a discussion. It's not a very good way to convince doctors or physicians that the practices are somewhat questionable. Because when you mention eugenics, you lose your audience immediately. People are just, no, that's not what we're doing, and then when they refuse to listen, what do you say after that? So I think that sometimes a better way is to make an argument first, and then boost it with emotionally charged analogy, or then reminding about the past and possibly making a fair parallel to what's happening now. Nowadays, the official policy is based on the principle of autonomy. For instance, in Denmark, the National Health Service declared on 2003 that there has happened a paradigm change in prenatal practice. Whereas previously, the main goal was prevention of disability. But now the main, and this was based, and it was even admitted that this goal was based pretty much on eugenic principles. But now the main goal is providing people with autonomous, unlimited freedom, or freedom of a choice. And so the success of prenatal genetic testing and various measures is measured by freedom of choice. So autonomy is the prominent value. Everything is based on autonomy. And in practice, this means that the more tests there are available, the more choices you have, and the more freedom you have. This is the kind of the logic, which can be, and people actually, I think, believe this. And they, although it's, of course, it's not very credible, because more medicalized and technological pregnancy gets, becomes, women are more and more at the mercy of doctors, who are the only ones who actually know what's being tested and how to interpret and understand these test results. Now, as for